Dear colleagues, my name is Professor Natalia Linkova. I am the expert and consultant of Peptides company. Now I will tell you about the effectiveness of peptide bioregulators to maintain the function of the male reproductive system. Libidon is a complex of peptide isolated from the prostate gland of cattle, which belongs to the group of cytomidins. Libidon is a regulator of the prostate gland function and the male reproductive system. Libidon is produced in the form of dietary supplements, capsules, and drops under the tongue. The next peptide bioregulator is testosterone. This is a complex of peptide isolated from the testes of mature bulls and pigs, which belongs to the group of cytomidin, and also we have these peptides in two form, capsules and drop under the tongue. Impaired pancreatic function, insulin resistance adversely affects testosterone synthesis in men. In this regard, Suprefort, a complex of peptide isolated from the pancreas of cattle, which belongs to the group of cytomidins, can be used to support the functions of the male reproductive system. Glandacort is a complex of peptide isolated from the adrenal gland of cattle, which also belongs to the group of cytomidins. Other peptide bioregulators are Vesugen, vessel-short peptides, and Winfort, which is polypeptide complex isolated from the vessels of cattle. Also, we have a new product, GPL-Man. It is an innovative product based on polypeptide complexes and other biologically active substances to maintain male reproductive function, support during sports, and prevent accelerated aging of the body. One capsule GPL-Man contains 16 milligrams of peptides. There are pineal peptides, peptides of brain, vessel, liver, pancreas, testes, and alpha-lipoic acid, antioxidant substance. So this is the results of effectiveness testosterone. Preclinical studies of acute, subacute, and chronic toxicity conducted on mice, rats, and guinea pigs showed the absence of side effects with single and long-term use of peptide extract of the testes of mature bulls and pigs. Testosterone in doses exceeding the therapeutic dose by 3,000 times. Although testosterone increased the growth of organotypic cultures, explants of rat testes by 35%. Also, we have done the effectiveness of testosterone in male menopause. This is a study design. Control group was 17 patients and the test group was 19 patients. There was a man of middle age. Control group have saline solution injection and test group have peptide injection. Complaints before treatment was fast fatigability, decrease in physical and mental performance, a weakening of memory, a sudden flash of head, increased sweating, irritability, and sexual weakness. So we have some positive results. The use of testosterone contributed to the improvement of the general well-being of patients. All patients noted improved sexual function, a decrease in symptoms of sexual weakness, and an increase in libido. There was a significant increase in the concentration of testosterone in the blood of this patient. There are another investigation. we have some hypotheses. A decrease in the level of free testosterone in men with distress syndrome is associated with an increase in the level of insulin resistance and a violation of the synthesis of phytohormones by the adrenal glands with normal levels of cortisol and blood sugar. So we have some groups. There was 105 patients, middle-aged patients. Patients were divided into several groups and received various combination of peptides drug for the adrenal gland, glandacort, prostate, libidon, testosterone, and pancreas, performed during 6 weeks. So we can see that after treatment by testosterone, free testosterone level and total testosterone level increased near 18%. And more pronounced and changed in the studied parameters were observed when using a combination of peptides complexes. So we can see that after treatment with a combination of adrenal, prostate and testicular peptides, free testosterone and total testosterone level increased in 54 and 24%, and the level of cortisol decreased in 8%. And the most strong effect we can see after treatment with a combination of adrenal, pancreatic, prostate and testicular peptides. We can see that the free testosterone level increased in 2 times. So the complex use of polypeptides from the testes, prostate, adrenal glands and pancreas allow for maximum improvement of hormonal status in men with a distress syndrome. This is another investigation about vascular peptides Vesugen. We use Vesugen in capsules in complex treatment of vasculogenic erectile dysfunction in elderly and old men. So Vesugen significantly increased 4 out of 11 studied indicators of the quality of life of patients. This was sleep, mental health, function of the lower extremities, and sexual function. Vesugen significantly increased the blood flow velocity in the dorsalis penis and profundus dorsalis penis arteries by 61 and 53%. So we can do the conclusion that the use of vascular peptides Vesugen, 1 capsule for 1 month, in elderly and senile patients with erectile dysfunction can improve the quality of sexual life, which is confirmed by an increase in the ultrasound characteristic of blood flow in the penile arteries. Vesugen can be considered as a promising drug for the prevention and treatment of atherogenic erectile dysfunction. The inclusion of Vesugen in the complex therapy for systemic manifestation of atherosclerosis can improve treatment results in patients of older age groups. The other investigation is efficacy of prostate peptides in patients with benign prostatic hyperplasia. The aim of the study was assessment of the effectiveness and safety of a combination of prostate peptides in the treatment of patients with benign prostatic hyperplasia. There are 16 patients of middle age. The first visit of patient was diagnostic procedures, and the second, third, and fourth visits was on 13, 16, and 120 days, and we show that prostate peptides was effective during all these periods. So we can see that prostate peptide increase quality of life index, normalized urine flow rate, amount of residual urine, and prostate volume. So the use of polypeptide prostate complex for 13 days has a positive effect on the subsequent and objective symptoms of benign prostatic hyperplasia. So we can do total conclusions. The polypeptide complex of the testes, testosterone, increases the level of testosterone in the blood and is effective for male menopause. The use of a combination of polypeptide from the adrenal glands, glandocord, pancreas, suprefort, prostate, lipidon, and testosterone helps normalize hormonal status in men with distress syndrome. A vascular tripeptide vasogen is effective for vasculogenic erectile dysfunction in elderly and senile men. The combined intake of the prostate polypeptide complex helps slow the progression of benign prostatic hyperplasia. So we can recommend you some schemes of application of peptide bioregulators for restoring hormonal status in men of the reproductive period. This scheme includes glandocord, testosterone, lipidon, and suprefort. You can use this scheme from 3 to 6 months. As an alternate of this scheme, you can use our new product GPL-Man, 1 capsule once every 3 days during 10 days, and after that you can increase the dosage of these peptide drugs. The other is the scheme for application of peptide bioregulators in age-dependent pathology of man reproductive system. It includes Revilab SL9, OML7, Vasogen, Lipidon, Cristagen, and Cartalax. We use Cristagen for normalize immune function of man reproductive function, and Cartalax is peptides for support of fibroblast function in prostate. Thank you for your attention.